asking, can you reverse heart artery calcification? My cardiologist said it's not reversible, and I just want to use and just wants to put them on statins, which is Repatha, angiogram, and stents. No diet review, insulin resistance, pre-diabetes, and everything else.
So you don't have insulin resistance or prediabetes, but there's calcifications in the arteries. Okay, that's really important. The question is, can that be reversed? And to some extent, yes, there's some evidence for that. There was some research done by the NIH on something called EDTA chelation. That's ethylene diamine tetracetic acid, which is a chelating agent, and it just is generally used for lead.
Hello, everybody. Welcome to the Healthy Heart webinar. We are in person with Dr. Scott. We are actually on a Barton retreat, company retreat, and today's actually Joe Barton's birthday, so we are celebrating his 50th together. And you had the Diabetes Solution Kit webinar yesterday.
Yes.
Today we're going to talk about healthy heart, and today's topic is salt. So welcome. Yes, we actually got someone's t-shirt that says salt. Let me make sure we got people started here. Welcome, welcome everybody. While I get this computer going, make sure I share on Facebook if I can. Oh, we'll try that later. All right, so today's topic is salt. And we welcome your questions, and we're going to do a little disclaimer right now.
So the information we give here is just for general purposes only. It's not for you specifically necessarily. It might be helpful to you. So what's important is that you take the information and apply it properly to yourself. And you may need help. You may need a doctor or professional to help you to understand if that's right for you.
All right. We were just in a meeting, and we were talking about how salt, the word salary, it has the root word salt in it. Why?
The Latin word for salt is sal, S-A-L. And so we have salary. If you think saline, water that's saline, salinated or desalination plants, that's getting rid of the salt. The ocean is saline, that's salt water. And salary comes from the same root word because the centurions, the Roman centurions, were often paid in salt. That was their pay they got, was a certain amount of salt. And so they were worth their weight in salt.
Not in gold, but worth their weight in salt.
Yes.
So is salt something we should be concerned about when we're talking about heart health?
Yeah. So this is the big myth of salt. We have this idea now that, oh, you should never eat salt. Salt's bad for you. And avoid salt. And so a long time ago, somebody came up with the idea that the blood pressure, the pressure in your veins or arteries, was causing damage to the arteries, and therefore you were getting heart disease, and that your arteries were getting atherosclerosis because of the higher pressures. And then they said, well, it makes sense then if we decrease the salt, if we decrease sodium, then we won't have as much blood volume, and with lower blood volume, then the pressure will go down, and then there will be less heart disease. And so it turned out the research shows just the opposite. When people go on low salt diets, they end up having more damage to their arteries for a totally different reason, unexpected. And the point is that the damage to the arteries is not caused by high blood pressure. It's the other way around. When you have damaged arteries and they don't function well, and they're atherosclerosis and their heart is pipes, the blood pressure goes up because of the artery atherosclerosis, not causing the atherosclerosis. So association is not causation. And that's the problem that we always have in medicine, is which came first, which caused which. And well, now we know that the blood pressure elevation is caused by the atherosclerosis in the arteries. Why? Well, it makes perfect sense when you have your heart beating to push blood through the arteries, the heart beats, the arteries relax. And then the heart relaxes and the arteries actually have muscles in them and they close down and push the blood through. So you have this constant beating one against the other of that creates a blood flow that allows the blood to get through every little artery, every vein, every capillary in your body. And that's hundreds of miles that it has to go through, that there's a lot there. So the heart, if the heart had to pump all of that blood by itself, it'd have to generate a whole lot of pressure to get it all the way through those pipes down to those little capillaries that are microscopic that you can't see. So the way it works is the heart beats, the arteries relax. The heart relaxes, the arteries beat. And so you have this going on. And that creates a beautiful blood flow. As we age, we get hardening of the arteries. As the arteries get harder, now you have the heart having to beat hard to get the blood flow through there. So remember, we talked about blood pressure, and everybody was scratching their head. Why is the blood pressure for an older person need to be higher than the blood pressure for a younger person? Remember, we were saying the 140s over 75 over the 70s was the optimum blood pressure for someone over 60. Younger people had actually lower blood pressure was better, but as you get older, you need a higher blood pressure. So the doctors are looking at the numbers for a 20-year-old and saying, well, everybody should be 120 over 80 or less. And but if we look at the numbers, the optimum numbers for a 60 or 65 or 70-year-old, it should be around 145. So the reason for that is if you have hardened arteries, then they're not helping the pressure a lot. So the heart has to do all the work to get it all the way through. And if you don't have enough pressure, then you're not going to get perfusion. You're not going to get that blood going out to every part of your body. And that's where you get all the damage being done. Things don't repair well. You get pain. Your brain doesn't work right. You get brain fog. You get Alzheimer's, memory problems. And it's because you're not getting enough blood to your brain. So what happens when your brain doesn't get enough blood? It goes, oh, I need more blood flow. And the brain only has one way of increasing its blood flow. It raises the blood pressure. Why? Well, because if you raise the blood pressure, then you get more flow up, right? Because it's got to go up. So the brain raises the blood pressure when there's less flow. So for all those reasons, as we age, we need a higher blood pressure. And it's not that it has to be that way. You know, if we keep our arteries young and we keep that arteries working well, and not hardened, then you don't need a higher blood pressure. So you get some older people that are just great at 110 over 65 or whatever.
So is salt something you need to be worried about putting onto your food?
Okay, that's the salt
your
part.
Sodium level, your salt, salt shakers on the table, salt shakers off the table. What should we do?
Okay, your kidneys can handle 40 grams of salt a day. That's 40,000 milligrams of salt a day. That's a lot. The recommended dose is 1/10 of that. It's about 4,000 milligrams a day.
From the government, they're saying we should only do 1/10 of what you're saying is good for us.
No. What I'm saying is they recommend 4,000 milligrams a day. But the kidneys can handle much more than that. In other words, you can excrete a lot more salt. Okay. Than that 4,000. So that 4,000 is sort of actually a minimum and not a maximum. And people often look at it as a maximum. Oh, don't eat more than 4 grams of salt a day. But you could eat 10 grams of salt a day. And people who sweat need more than that. They used to have salt tablets for people who would work outside and they'd be sweating a lot. And when you sweat, you're getting rid of sodium a lot. It's, you know, if I sweat a lot. I don't know. Some people don't sweat as much as others. And then you're losing all that salt and your blood volume will go down, and you drink water and you're still thirsty. And you drink more water and you're still thirsty. You drink more water, you're still thirsty. Why? Because you don't have enough salt. So let's talk about what salt does.
Okay.
Okay, so salt keeps the volume of blood up in your body. And if you don't have enough salt, your volume drops down, and then you don't get good blood flow to everything. And then you feel thirsty and you go, wow, I need some water. And it's generally because you don't have enough volume of blood to keep your circulation going well, to get your perfusion out into your tissues. So you need more salt to keep that blood volume up. And that's really important, it turns out, because that does other things. The salt content protects that lining of the arteries. Remember, that's the cause of the heart disease, is damage to the lining of the arteries. And if you don't have enough salt, then you get more easily, the lining of the arteries get damaged.
Because your volume inside your blood vessel is too low. So you need the salt to actually increase the volume in your blood vessels so that they pump better. And I've been seeing a lot of people online, if you want more salt, put a dash of salt in your water. You don't need to drink all these electrolytes, just put a dash of salt in your water. Is that enough? Or should we be salting our food? I remember one time we were at another Barton retreat, we were making mashed potatoes. I think I put too much salt in it. And you're like, that's okay. We had very salty potatoes. So, and you're like, we need salt. People actually don't get enough salt. So back to the same question. Can we put a little bit of salt in our water, or should we be salting our foods? And what kind of salt? That's another question.
Oh yeah, we'll go into that. So the putting salt in your water is fine. You're generally not going to eat like saline, like seawater kind of saline. But a small amount of salt is okay. That's fine. Salting your food is okay. That's okay. A lot of people, they live without any salt. Okay, I never salt my food. I never put any salt on. When I go to a restaurant, I tell them don't put any salt in it. And so they have a minimal amount of sodium coming into their body, and that causes volume depletion and dehydration. So we think of dehydration as not enough water. But if you don't have enough salt, sodium, then you drink water and you pee it out, and you drink water and you pee it out, and you drink water, and you just can't keep it in your body without the salt. You have to have the sodium in there to do that. And so salting your water, salting your food, those are okay things, and they're actually good for you.
All right. So what kind of salt should we use? Okay,
that's a good question. A lot of research has been done on that. So essentially, salt is salt. So if you get the kosher salt or the sea salt or the Himalayan salt, all of those salts, okay, they're fine. There's nothing wrong with them at all. But people think, oh, we're getting a lot of trace minerals, and there really isn't that much trace minerals in them. Sea salt does have some magnesium in it, which is helpful. It's really interesting. In Finland, they did a study on salt where they exchanged in this area of Finland. They exchanged sodium salt shakers with a magnesium potassium. It's a salt substitute instead. And people using the salt substitute, they did better. They had less heart disease, fewer heart attacks. But what were they using? They're using potassium magnesium salts. And guess what? Everybody's deficient in potassium and magnesium also. So when you're adding the salt to your water, the value of the electrolyte solution, as opposed to just a pinch of salt, is that you also get potassium, magnesium, and sodium, which are often all deficient.
Yes, we've talked about that before. So I'm going to say hi to everybody now that we've talked about salt for a little bit. And remember, you can go to bartonwebinar.com for more information about the Diabetes Solution Kit, the Healthy Heart Solution Kit. Buy some of our supplements like magnesium. We've often talked about everybody's deficient in magnesium. So we have a magnesium supplement. Use Barton 25 webinar 25 for a 25% discount. So let me say hi to people who are here and maybe start answering questions. Hello from Alicia in the UK. Hello from Patty in Houston. And Eric is back. Eric Howell, hello. And let's see, let's get to some of our questions already. Roy asks, what's the best way to balance my salt and my potassium?
Okay. The best way is to allow your kidneys to do it. Your kidneys are so good at this. And so all you have to do is provide enough for them. And more is okay. If you have extra salt, like I said, you could live on salt pork. And as long as you're getting enough water and potassium, your kidneys can handle that. It's not the salt that's the problem. The salt is not a problem. And that's really where the myth comes in. We talk about the myth of salt. Salt is not a problem. And so there's no fine line that you have to be careful to get not enough or too much. If you're thirsty all the time, then look for the 3 sources of dehydration. You may need sodium, you may need water, or you may need potassium. So to balance that, sometimes you have to kind of work with it and find out. I personally like to get most of my water from fruits and vegetables. So when I'm thirsty, I'll often eat an apple. And if that doesn't, because that'll give me some potassium. So if that doesn't help, and if I'm thirsty, then I'll drink a cup of water. And if that doesn't work, I'll have something with salt in it. And so usually, if you're low in salt, you'll crave it. You'll say, I want something salty, and that's okay. Then have salt with that. It's not that you have to walk a fine line and say, well, you can only have 4.5 grams of salt a day. Don't count the grams of salt. just go, okay, I'm going to make sure I get enough salt, whatever salt your food, use salt. But then potassium too. Potassium, you can't just, use a potassium salt that easily, or take potassium pills. People do, but they're like 99 milligrams. And what you need is like 4,000. So, you take 40 of those potassium salt pills, and that's just once a day, like every day. So you count that all your fruit and vegetables have salt, have a little bit of sodium, but a lot of potassium. It's like 10-to-1 potassium to sodium. So if you're eating fruit and vegetables and getting a lot of your liquids from fruit and vegetables, but it doesn't have to be that. Dried fruit has a lot of potassium in it. So if you're eating like dried apricots, they're really high in potassium. Well, they're dehydrated. And so you can eat like 10 dried apricots, but you wouldn't necessarily have 10, fresh apricots.
So I just want to go back. If people are worried about high blood pressure, then doctors are telling them to avoid salt. You're saying that you really don't have to worry about it if you have high blood pressure.
Right.
That's something else.
What the research shows is that low salt diets are not healthy. They don't lower blood pressure, because that's not the issue. And dehydrating yourself is not a healthy thing to do, even if you have high blood pressure.
And I think we've talked about this before, but some people drink too much water, right? And so that's actually worse for their blood pressure, right? Because it's draining. It's actually creating lower pressure in their vessels, right?
Right. So what happens is people are told you should drink a gallon of water a day, or the number of ounces is half the pounds you have, or whatever. And so people I had nurses when I was working in the hospital, a 1 gallon jug that has an 8 o'clock, a 10 o'clock, a 12 o'clock, and it's got, this is how much she had to drink by that time each day to drain her 1 gallon jug throughout her workday. And of course, she's spending a lot of time in the bathroom. But here's the side effect of that. Salt. When you're drinking that much fluid, your kidneys are getting rid of the fluid, but guess what goes with it? Salt. So you're losing sodium. So you're actually, what you were saying, getting dehydrated while you're drinking all that water. And so people are going, yeah, I drink, but I'm always thirsty. I have to drink more. I'm just always thirsty. So they carry around a jug of water with them, constantly drinking. And the problem is not water. The problem is salt.
What about people who crave salt? Like, there are people who love salty things. There are people who love sugary things. Do they actually need more salt if they crave it? What, potato chips all the time?
That's a good question. And I don't know the answer to that.
Okay.
Well, I don't know of any research that's been done on that. When I crave salty things, I eat salty things, but I don't crave them all the time. So I don't know if somebody craved them all the time. Would that be bad? Potato chips.
Well, potato chips are too much are probably a bad thing. All right, let's get some more questions going. All right, Helena Helena asks, are there particular high fiber foods that are good for raising the good HDL cholesterol? Greatly appreciate the valuable info you provide through the webinars. Thanks. Thank you for talking to us, Helena.
Okay, so Helena has a great question. What kinds of fiber are the best to raise the HDL cholesterol? And so statistically speaking, as far as research goes, any fiber does it. Soluble fiber is a little better. And the soluble fiber is the type that dissolves in water. It's things that we don't digest. It's different types of starches that we don't digest, fructooligosaccharides, for example. There are types of sugars that bacteria use, but we don't use. And then and they raise the HDL cholesterol. And then there's the insoluble fiber, and that's the fibers that you see. It's the cellulose, it's the cardboard part. It's the part you throw away when you juice. That stuff actually lowers the LDL cholesterol as well.
The pulp.
The pulp, right? So both of them are really important. And the idea of fiber is not to add one type of fiber to your diet and say, okay, this is a good type of fiber. I'm gonna just eat that and get a ton of that kind of fiber. Well, then you have a very narrow scale of bacteria in your large intestine. You want the maximum amount of different types of bacteria in your large intestine, and that's done by different types of fiber. So some bacteria use this type, some bacteria use that type. Some bacteria digest the protein fibers better, which is found in like keratin and collagen. And others digest the saccharide types, the sugar or starch types of fiber better. So having a wide variety is what gives you resilience in your large intestine and helps you function better, including with your cholesterol. But we talked about the cholesterol myth. So, so if you're worried about cholesterol, go back and look up that one. That's a good one.
Yeah. Also another myth about high blood pressure and what your doctor is telling you about cholesterol. We have something different to say. All right. Paul asks a question. How much salt is in the TBL spoons? Do you know what I'm talking about?
Yeah. So if you're looking, so we were talking about grams, how many grams of salt. So 1 teaspoon is about 4 grams of salt. So every quarter teaspoon is a gram. So if you look at the recommended total amount of salt in a day is no more than 1 teaspoon. So a tablespoon is 3 teaspoons. So that would be 12 grams of salt a day. And so you could handle, 4 tablespoons of salt a day. Your kidneys can process that pretty easily. But if you've ever heard of people being stranded out in the ocean and now all they have is seawater and they die of thirst, the problem is that the amount of water amount of salt that's in the water, if you drink the water, you're actually getting dehydrated, because in order for your kidneys to get rid of that salt, they have to get rid of more water than you're drinking. Does that make sense?
I hope so. People die by drinking salt water when they're stranded in the ocean. You're not stranded in the ocean, hopefully, so you don't have to drink the salt water from the ocean. All right. David asks, so what is the minimum amount of salt needed per day? I had understood that salt was mainly used as a preservative, and before preservatives, humans used less salt. Well, that's an interesting question.
Well, yeah, salt has been used as a preservative for thousands of years. And that was one of the main reasons that, they would catch fish and they would put fish in a barrel and just dump loads of salt on it. And they would be able to send that fish out. And so people would have those preserved meats, preserved fish, and other meats and things. So salt has been used for preserving for thousands of years. And people ate more salt when they were eating preserved meats and fish and preserved foods with salt. And as long as you're getting enough water for your kidneys to get rid of that amount of salt, that's fine. And so there isn't like a minimum so much as like how many grams of salt you have to have minimum amount. because your kidneys are really good at preserving salt too. If you're not eating salt and you're not drinking too much water, then you can hold on to salt and keep your blood volume up pretty well. There have been stories of people like in the desert who have gone, 14 days without drinking anything, and they're sweating out salt, but they just stop sweating, and the body has ways of equilibrating what you're not taking in.
So David, are you worried about you just want to take the minimum? So let us know if that's why you're worried. You don't want to take too much. Why are you worried about the minimum amount of salt?
Yeah.
Maybe we can answer that later. Okay, Aubrey asks, is it okay to put baking soda in your water? It helps with acid indigestion, but is it too much salt?
That's good question.
Yeah,
yes,
good question.
There is sodium in baking soda, sodium bicarbonate, right? And yeah, baking soda, people use that, and it's not too much salt. Definitely not. When you're getting, how much are you putting in there? A half a teaspoon or something like that. Pinch. Or yeah, sometimes as much as a half a teaspoon, because I've talked to people who have renal failure, their kidneys, that they have kidney disease and chronic kidney disease from diabetes, for example. And the studies show that a half a teaspoon of baking soda in water every day, drinking that down, decreases the chances of getting into dialysis and renal failure. Mm-hmm. So it actually improves the kidney function to have enough of that baking soda, which part of it is getting enough sodium. The other part of it is alkalinizing the urine.
So does it help with acid indigestion to put baking soda in your water? That's part of our question.
Okay, so in the other half for indigestion, yes, baking soda is one way of neutralizing the acid in the stomach if there's a lot of acid. It has benefits, but it also has risks, because one of the things that happens when you neutralize the acid is the pH goes up and the stomach starts saying, oh, we need to make more acid. And then you perpetuate a cycle, so to speak.
Well, isn't there another myth about most people think when they have stomach problems, they have too much acid. That's another myth. Often you don't have enough acid. So if you're drinking baking soda, will that push down the acid or make it go up?
Well, it will neutralize the acid that you have and cause your stomach to make more to bring that acid level up.
All right. Is that good or bad?
It's bad.
Bad. Okay.
Ultimately, you get immediate relief.
Yeah. Yeah. Okay. I love all these questions. Alicia asks, do tomatoes and bananas offer sufficient potassium to balance sodium levels if eaten every day? Oh.
Yeah, tomatoes and bananas are good sources of potassium. Any fruits and vegetables, and everybody says, oh, you got to eat a banana to get potassium. So in comparison, ounce for ounce, if you eat an orange or an apple, you're going to get about 3 grams potassium, right? 300 milligrams of potassium. A banana has 400 milligrams, so a banana has more. The problem with that, it also comes with a lot of carbohydrates, but I don't know if that's a problem. Tomatoes are great, because if you're getting like tomato sauce, tomato paste, you're taking, 20 or 30 tomatoes and packing it into the size of one, and you're taking all that potassium, and you're getting a lot of potassium in your tomato sauce, for example. And so that's a great way without adding a whole bunch of carbohydrates. So yeah, that's a great way. But think of it this way, that all of your fruits and vegetables are giving you potassium. If you eat a avocado, you're getting 800 milligrams. That's twice what a banana is. If you eat a baked potato, you're getting twice what's in a banana. So
a baked potato has twice the amounts of potassium than a banana.
Yeah.
Wow.
About 800 milligrams.
And then add a little salt on it. You have a perfect food, in my opinion, and some good Kerrygold butter. All right, Connie. People say don't drink water while eating your food, and some say it's okay. Your thoughts?
Okay, I have thoughts on this. I've read some research. It's not clear, but I have an idea. And the way I look at it is, if you're drinking while you're eating, you're diluting the digestive juices, including the acid, and acid is needed for certain proteins. Some proteins, for example, yesterday we made ceviche, and
You made some
ceviche,
great ceviche.
it's raw fish that's cooked essentially. I just leave it in the refrigerator for about 5 or 6 hours in lime juice, and I squeeze the limes and I put them in, and half a cup of lime juice, and fill the rest with the fish. And the acid in the lime cooks the protein in the fish. By cooking, it means it denatures the protein in the fish, and that's what cooking does too. Heat does the same thing. Well, in your stomach, you have acid to denature proteins. That's its purpose. And if you're diluting that acid, then you may not denature all the proteins. Some, like fish, are easily denatured in lower acid environments, but some, like gluten and gliadin and milk proteins, casein, are very difficult to denature, and they require a very high acid level to denature them so that the enzymes can cut them up into pieces. So what happens is those whole proteins, because you're drinking with your meal, go into the small intestine, and the immune system goes, hey, that's not supposed to be there, and starts attacking it. And then you end up with this celiac disease or other inflammatory bowel disease or something. It's not clear, but I don't drink with a meal, partly because of that. And the other part is for hydration. Or for eating too much. So it was shown in several studies that people who drank with a meal, anything, at first the study was done comparing having soda with a meal versus water. And they found out that water also caused weight gain. So why is that? Well, people eat 1/3 more if they're drinking water, because the saliva stops being made when you're done eating, when your stomach's full. And you make cholecystokinin, you actually stop making saliva, so you can't swallow, you're done, can't eat anymore, right? And people do that. They get halfway through meal, go, can't eat anymore. But if you have water, you can wash it down. And so people would wash down more food than they would normally be able to eat because they're drinking with a meal. So 2 reasons. One is I don't drink with a meal. One is so I know when I'm done. And then number 2 is so I don't dilute my stomach juices.
I know some people say, like, drink a cup of water before, like an hour before you eat.
I've heard that too.
Yeah. Then there are cultures who drink tea after they eat something hot. Is there truth to like drinking a hot cup of tea after you eat to help your digestion?
I don't know of any research on that. I don't know.
Interesting. All right. For this is the great questions coming in. Keep them up. Fernando asks, heart arteries calcifications could be reversed. So I think he's asking, can you reverse heart artery calcification? My cardiologist said it's not reversible, and I just want to use and just wants to put him on statins, which is Repatha, angiogram, and stents. No diet review, insulin resistance, pre-diabetes, and everything else.
So you don't have insulin resistance or pre-diabetes, but there's calcifications in the arteries. Okay. That's really important. The question is, can that be reversed? And to some extent, yes, there's some evidence for that. There was some research done by the NIH on something called EDTA chelation. That's ethylene diamine tetracetic acid, which is a chelating agent, and it just is generally used for getting lead out of the body. But it turns out it also takes calcium deposits out of the arteries. So one study showed that worked to take the calcium deposits out of the arteries. Several studies have shown that vitamin K in high levels, vitamin K2. So K2 given in 300 micrograms to 1 milligram level, that would be 1,000 micrograms, 300 to 1,000 micrograms of vitamin K2 will take the calcium out of soft tissue and put it into the bones. And that's the wonderful thing about vitamin K, does that. So a lot of what was happening because of osteoporosis, women were given calcium pills to take. And they found out later, after some long-term studies, that calcium was getting deposited in their arteries, and they were getting hardening of the arteries from taking calcium for osteoporosis. And the reason was because they didn't have enough vitamin K. K2 is found in fermented foods, and a lot of people just don't eat fermented foods and things like natto. Who eats natto or miso?
Sauerkraut.
People may eat small amounts, but it's not something that's really common. Vitamin K1 is found in green vegetables, and that's a good source of vitamin K as well. So there is some pretty good evidence that adding vitamin K does reverse that, does take the calcium out of the soft tissues and put it into the bones.
And I believe our Healthy Heart supplement has vitamin K in it.
Correct.
So you can look more into our Healthy Heart supplement, go to bartonwebinar.com. All right. Alicia asks, I'm going to a clinic in California that is a water fasting clinic. No problem with that, but the protocol when back to eating is the SOS diet. That is sugar, oil, in particular salt-free diet. I guess this is not so good to do then. I struggle to eat this way. Any comments?
Okay. I love the True North Clinic, by the way. I know where you're going, and it's great, Alicia. I know the people there. I've had patients go there. I've sent people there. And there's a good reason why they go on avoiding oils and sugars after you're done fasting. So the first thing you want to do is get fiber in your diet, because what the fiber does is allows the good bacteria to start growing in your intestines. So you're feeding the good bacteria when you first start eating. We think we're feeding ourselves by eating food and forget that, we're just like a spaceship for our bacteria. Our bacteria are controlling us. They make us feel good, feel bad, gain weight, lose weight, all this stuff. And it's all controlled by the bacteria in our intestines. And we have to feed them good food. And their good food is fiber. So that's why in coming off the fast, you're going to have a high fiber diet, and you're going to avoid sugars, oils, and then salt. So as far as salt, I do disagree with that because the evidence for the salt is that if you get enough salt and you get enough water and you get enough potassium, then the sodium is okay because you have enough potassium and water for your kidneys to manage your salt levels perfectly. So I don't know.
Can you give it a little background on what is this water fasting clinic and why Alicia might be going there? Yeah.
So the True North Clinic has been around for a long time, like 20 plus years. And they do water fasting. They also do others. They do short-term fast. They do longer-term fast. I've had people go there for 10 days, 2 weeks, but you can go for a month. And they monitor you and they teach you. They have classes and they teach you about how to eat and how to fast and all that kind of thing. And they test first. They make sure that you have your electrolytes are balanced, and they do the blood tests to make sure your kidneys are functioning well and everything's okay for you to be able to fast. And the reason why is because it cures almost everything. Almost everything. Everything that we deal with today: diabetes, heart disease, cancer, the 3 leading causes of death are all essentially cured or reversed by fasting. Blood pressure goes down to normal. I had somebody who did a water fast for 30 days. He had severe heart disease, severe, like he couldn't walk 10 feet without going, feeling like he was dying, trying to catch his breath. And his cardiologist told him his calcium deposits, by the way, if you know what a coronary calcium score is, normal is up to 100. He was 1200. He was like way off the charts for the amount of calcium in his arteries. And he fasted for 30 days. At the end of 30 days, he was playing a full tennis match and going and working out at the gym afterward. And 3 years later, still has no chest pain at all and feels fine. So why would you go to the True North Clinic? Well, you get results like that.
what would be a really intermittent fasting is talked about a ton. I see Instagram saying you got to do this kind of intermittent fasting if you have this body type. Do this kind of intermittent fasting if you are this age. What would be a great introduction to fasting, to start fasting without having to go into deep, taking a bunch of quizzes?
Yeah. Okay. There's a simple way to do it. And there's actually a really good book. The book is written by Jen Stevens.
Okay.
And it's called Fast, Feast, Repeat. That book it gives you a broad range of different ways of fasting, and you can get started with a 12-hour fast, or you have a 12-hour window of eating, and then you just cut it down to a 10-hour window of eating, and then you go to an 8-hour window of eating, and you end up somewhere around a 5-hour window of eating. So that your majority of your day, 19 hours, is fasting, and you have 5 hours of eating. And you can move that around. You don't have to have it in the same place every day, but like your window of eating has to start every day at 12 and end at 5. That's not the way it has to work. You can say, well, I'm going out to eat at 8 o'clock tomorrow night, so I'm going to move it up to a later time, but I got to have breakfast tomorrow, so I'm going to move it down to breakfast time. So there's a lot of variability. And so the reason I like this book is her motto is tweak it till it works for you. So that means, and she gives you all the different ways of doing it so that you can tweak it. Some people eat every other day. So they eat 3 meals a day or all day long one day, next day, no food at all. Next day, eat all day long, next day, no food. That kind of thing works. And some people do 1 meal a day. Some people do the 5-hour, 8-hour window, whatever. All of those options, she explains in the book what works, what doesn't work, and how to fast. And she describes very clearly what a clean fast is.
All right. I think we talk a little bit about fasting in the Healthy Heart Solution Kit book. I don't have an example with us, but you can also buy the Healthy Heart Solution Kit, work on your blood pressure with a lot of our other modalities in that, not just fasting.
Right.
All right, Connie asks, we have an RO system, which is reverse osmosis water system in our home. So my question is, since the RO takes out almost everything in your water for purification, should we be putting the minerals back into the water?
Well, there's a lot of research on this, and that's kind of interesting because the RO systems, when Israel, for example, doesn't have enough water, so they put RO systems in for their city water. You know, the city of Tel Aviv has a lot of RO water in it, and they actually found problems, especially with magnesium deficiency. So increasing heart disease because of a lack of magnesium. So there is some evidence for that your RO system is taking out minerals that are otherwise pretty well absorbed through getting your water if it's in the water. So yes, I would suggest, just because of the research, to add minerals into your water. And they make all kinds of mineral solutions that you can, take your RO water and fill up a jug and put this little packet in there that'll have potassium, magnesium, even some sodium, and then trace minerals in it.
So is it valuable to have an RO system then?
For some people, yes.
Okay.
Some places, I don't know, where I live, we have 3 flavors of water. I call them flavors. It's either mold flavored, or it's chlorine flavored, or it's bromine flavored. And the flavor you can get out with a filter like the mold flavor. So we have a carbon block filter that gets the flavors out. But the chlorine, the bromine may not come out. And in that case, if you have high bromine in your water or fluoridated water, you definitely want an RO system.
Okay, good to
because
know.
they are toxic.
Yeah. And I've looked at our water in my city where I live, and they actually add food coloring to make the water look blue.
Oh, interesting.
Yeah. All right. Paul asks, thanks for the answer on the salt. How much Synachroma can you take in a day? So Synachroma is our supplement for high blood sugar, not high blood pressure. You can also find that information at bartonwebinar.com. But how much Synachroma can you take in a day?
Synachroma was formulated for 1 a day. So if you look at how much vitamin D is in there, It's 5,000 international units, which is on the low side of a 1-day supply. That's if you're not getting any sun, that's what you're going to need, kind of thing. For people who want to be on the higher end, for whatever reason, if they have osteoporosis or something, want to be the higher end, then 2 a day would be appropriate for that. The other nutrients in there include chromium, vanadium, and selenium, which are also formulated for 1 a day, so that you don't have to take more. When you're first starting, especially if you have type 2 diabetes or something, then taking 1 twice a day is just fine. So you can do that, but long term, you wouldn't do twice a day. You would just do once a day.
And you do 1 in the morning and then 1 with your largest meal of the day is kind of what we have recommended in the past.
When you're starting off.
Yeah, when you're starting off, it lists that in the diabetes solution kit. Yeah. All right, Susan asks a question. Hi, I had a minor stroke. Can I talk? A minor stroke a few years ago. Doctor says I have plaque in several areas of my cerebral arteries. I asked them how to clear it. They say it is unremovable, and that is like a concrete in the walls of the arteries. And then it can also cause breakage in arteries due to the hardness factor. These thoughts concern me much. Do you recommend for cleaning arteries, including cerebral arteries? And can you recommend clear plaque?
Okay, so some way to clear plaque out of your arteries is the same everywhere. You have to ask the question, what is the plaque and why is it there? So that plaque comes because of damage to the lining of the arteries, causes clots to form so that you don't bleed to death, essentially. And then the APCs, the lining of the arteries comes and paves over the top of that clot, but it doesn't dissolve. So it ends up getting calcified, causing inflammation and getting calcified and staying in the arteries. So the question is, can you clear it out? Well, we talked a little bit about how to get calcium out of the arteries. If you have plaques in your cerebral arteries, there's probably something else going on. This is not a normal thing. This doesn't normally happen. So if it's there, it generally means that you have a genetic abnormality that's causing these plaques, which are clots in the lining of your arteries. So if you're getting clots, you may have a clotting factor problem. Look that up. There's something called thrombophilia, which is factor V laden deficiency. And so having a genetic abnormality may cause that. Another important one to look for would be Lp(a), the lipoprotein A. So test for that, because if you have lipoprotein A, you can take niacin and you can dissolve the clots. It will actually reverse that process. So knowing what the cause is will help you to reverse the process. And whenever doctors are told how to do things, and whenever we don't know how to do things, then we say, well, you can't do it. What it means is, I don't know how. So when a doctor tells you you can't reverse plaque in your arteries, what they say is, what they mean by that is, I don't know how to reverse plaque in the arteries. And if you just look at it as that, so the expert you're talking to says, I don't know how. Okay, I wonder if anybody else does. And there's a whole lot of research out there on how to reverse plaques in your arteries, reverse heart disease, reverse or prevent strokes, reverse other arterial disease. Yeah.
All right. So either find a new doctor to get those tests done.
Or just ask for the test.
Yeah. All right. Patty asks, is Gatorade good to drink to replenish salt levels? I live in Houston and it's humid.
The answer, no.
I'm not surprised.
Because it has so much sugar in it. And so what happened is the Gatorade people, so the Florida Gators, came up with this drink, a rehydration solution for their players on the field.
Football players, for those of you who don't know. Football
players, right. So they had sodium, potassium, magnesium, and then some trace minerals. And so they had, and it was glucose solution, right? So all of that was what these players did. They're doing their hardest, and it's humid and it's hot and they're sweating like crazy. And so they did a lot of research at the University of Florida to find out what can we do to rehydrate these players. And so they came up with Gatorade. So, and it was working just fine. It didn't taste good. So when a marketing company took Gatorade and said, we're going to market this as a health drink, it didn't taste good. So they had to put high fructose corn syrup in it, which it didn't have before. They had to take some of the salts out because potassium, magnesium salts, they don't taste good. They're not tasty. So in order to make it taste good, now Gatorade is no longer a rehydration solution. So don't ever think that again. No, just, water and salt your food, or even put, like Cheryl was saying, put a pinch of salt in your water, especially if you can get potassium, a little bit of potassium, magnesium in there, or those the little packets of minerals that you can put in.
So what about Pedialyte? Like if you're sick and you've either got something coming out of your body one way or the other, would you recommend Pedialyte? A lot of people turn to rehydrate themselves with something like Gatorade or Pedialyte when they're sick.
Yeah. So Gatorade, no. Pedialyte is actually a better solution. It actually has more of the potassium. Pedialyte was more made for like diarrhea, vomiting kinds of problems, which you're losing a lot of potassium, as opposed to the Florida Gators on the field sweating, where they're losing more sodium. So there's more potassium in the Pedialyte solution. And that's okay too, but you're just as good drinking water and getting enough salt.
All right, good. Let's see. Rita says let me see if I can read this. There have been times when I have craved green olives. I'll eat a small jar every few days. Is this okay? Sometimes it's pickles. Pickles or olives?
Yeah, I don't know if the craving is okay. You're definitely getting more salt because these are two things that are packed in salt. And if that's what your body needs, and if you're not getting like edema or swelling up of your legs or anything of fluid overload, and you have good kidney function, then it's fine. It's not a problem.
I hear people drinking pickle juice. All right.
There's a good rehydration solution.
Pickle juice?
Yeah, no sugar.
And if you like dill pickles, I love dill.
Yeah.
All right. Alma asks, is there a distinction, I think, between plaque and atherosclerosis classification? I have the latter now, but my cardiologist didn't answer if I had plaque. He just wants to talk about cholesterol.
Okay. So, my father died a couple of weeks ago of a heart attack. And when we were doing a bunch of studies, I was helping him along with it. And his doctors were doing all of this tests. And I say, okay, Dad, you need this test, this test, this test. And so he'd take the tests. Well, he had bladder cancer. And so they were looking in his abdomen for like the liver and all that, for metastases and all that. So we did a CT scan. And the CT scan of his abdomen showed calcium deposits all the way through. You could see his aorta beautifully. It lit up because it's an X-ray, right? And the calcium lights up. You don't normally see an aorta on an X-ray. And you could even see even the smaller arteries, like the mesenteric arteries and the renal arteries, and they were all lit up because they were lined with calcium deposits. So the calcium deposits aren't necessarily atherosclerotic plaques. The plaques are where you have clots, and the clots, they actually decrease. So you have an artery that's this big around, and then the clots come and they decrease it, and they kind of push into the center of the artery, decreasing the size of the artery in that particular area where the plaques are. So the atherosclerotic plaques is kind of a combination of these plaques that are clots that get organized and they get calcified, but it's not the same as having calcium deposits. So like the guy I told you about that had heart disease, and his coronary calcium score was 1200. So here's a great thing. So we looked at his arteries after he did a fast. He did a 30-day fast. He's playing tennis. He's working out in the gym. he's doing great, no chest pain, he feels fine. So we redid his test to see, he wanted to know, well, do I still have all those plaques and arteries? His coronary calcium score was 1,500. It went up like a lot, not a little bit. It went up a lot. He's like, what the heck?
Yeah.
I work really hard and I expect to reverse this plaque. Okay, it didn't reverse. And so we talked about other ways, other things that would actually reverse the plaque. Like the vitamin K thing that we were talking about before, EDTA and those kinds of things. But the point is, here he has worse plaque and better function. So, it didn't correlate very well because the calcium deposits, the calcification of the arteries isn't necessarily narrowing the artery. That's the difference between the plaque and the calcium deposits.
Okay. All right. Well, I see a question from Krish. He's one of our regulars. While time and again, plant-based oils, corn, soybean, and even canola oils are bad, are not expeller pressed oils okay and safe for consumption? My rationale for that is the expeller pressed oils do not go through solvent extraction. Please comment on this.
Okay. Solvent extraction is where they use toluene. So they take all the seeds and everything, they crush them, and they put them in toluene, which is a nasty chemical, but it dissolves all the oils, and then they take it all out into a vat and they boil off the toluene, and they actually recycle it. They don't just boil off, but they boil off toluene, and then what's left over is the oil, right? And that sounds like an ideal way to do it. However, the expeller expressed is just like if you've ever seen an olive press, where they actually press the olives and then the juice runs out and the water part separates out, the oil part rises to the top and the water's on the bottom, and then they just drain off the water, and that's expeller expressed. It's the two different ways of getting these oils. As a general rule, yes, I would think for many reasons that the expeller express would be better nutrient wise and less toxic in whatever way that is. By the way, the toluene isn't in the oil, but the toluene also dissolves out other things that are not normally in the oil, the expeller expressed oil. So the answer to the question is yes, expeller express, I would think would be better. Number two is these oils are really not good in high amounts no matter what. So if you're using olive oil periodically and using some corn oil or whatever periodically, that's not the issue. The issue is having this really high level of omega-6 fatty acids from these vegetable oils and seed oils compared to the omega-3s. And that's why people are popping fish oil pills, is because they're eating so much of these vegetable oils. So if you get your vegetable oil level down, then you don't need as much of the omega-3s.
I've also heard that single origin olive oil is better than, like, if you go to the store and you'll read the label and they have olives from Greece and Italy, it's kind of like the leftover bad olives. But if you buy a single origin, it means that they're using the best batch and they're not giving the leftovers to someone else to make oils out of. Something I've heard. All right. Delna asks, do you recommend 2 tablespoons of apple cider vinegar with 2 tablespoons of lemon and 1 teaspoon of Himalayan salt shots every morning to lose weight? I think you know where this is going.
Okay. Yeah. Okay. So the apple cider vinegar and the lemon are acids that you're putting in, and then the salt. As something to keep your electrolytes balanced, it's great, it's fine, not a problem. As far as losing weight, the idea of it is it's supposed to make you feel full so that you don't have that hunger hormone, ghrelin, to deal with, so that you can lose weight that way. if it's helpful for you, fine, but it's not something that is a long-term solution necessarily, because really, ultimately, the amount of fat we have on our bodies is dependent on what we eat. The amount of muscle we have on our bodies is dependent on our exercise. So if you look at your diet and say, well, what am I eating? Or when we were talking about fasting today, if you just limit the amount of time, that's been shown to be more beneficial to limit the amount of time you eat than to limit the type of food you eat. So people who eat junk food, who fast periodically, actually do better. People, I know of the rat research. So rats who eat junk food and fast periodically do better than rats who are fed consistently with a very healthy diet.
Wow.
Yeah.
Yeah. All right. Maybe we'll do one more question, and let me see. Okay. Paul asks, are the fiber greens you sell good for nitric oxide?
Nitric oxide is what dilates blood vessels. This is really important for heart disease, because if you don't have enough nitric oxide, then you don't dilate your blood vessels well, and you can't drop your blood pressure, and you can't get blood flow to certain areas. So dilating blood vessels is really important. And that's the reason, by the way, why having enough salt is important. If you don't have enough volume, and you can't dilate your blood vessels to get blood flow to certain areas of your body. And so you diminish the amount of oxygen that's available to those tissues. So nitric oxide is an important part of that. Fiber green specifically is not made for nitric oxide. That's not its purpose. There are other things. If you get enough arginine, for example, is an amino acid that is in protein. So when you're eating protein, you get arginine, and that's what the body uses to make the nitric oxide. There are also a lot of other nutrients that are important for that, some of the vitamins that we use. But the fiber greens is primarily for fiber that feeds the good bacteria in your intestines. That's primarily what it does.
Okay. So you did mention salt, and we're running out of time today. So this is a salt webinar. And I think the important thing, we had great questions. Come back next week. We're going to answer more questions. But today, I think I want to make sure people go away with not to fear salt. I think that's what most doctors are telling you, to fear salt.
Yeah, don't be afraid.
Because salt is good for your blood vessels. It's going to increase your volume and bring more oxygen to your little capillaries in your toes and in your head. Any other last minute words about salt?
Yes. You don't need to count. That's the other take home message is your kidneys can handle salt. They can handle a lot of salt. Get enough water, get enough potassium, get enough salt, and you'll stay hydrated.
All right. Good news. All right. We're going to come back next week, I think, for another myth. And we'll have hopefully Leslie back. Thanks everybody for joining. We look forward to seeing you next time and answering more of your questions. Bye.